schedules to join us. So hopefully you'll find it really worthwhile. We will be recording this session for our own training purposes. So hopefully everyone is okay with that. And you will see that your transcripts are automatically turned on. If you find this slightly annoying or frustrating, then feel free to turn that off using the transcript button on your bottom of the toolbar on your screen. The way it will work today is we'll run for an hour and you will be going into your breakout rooms at 12:30 for 20 minutes. So let's get started. My name's Abigail Price and I am a health lead at Active Surrey. Active Surrey are the strategic lead for physical activity across the county. I'm also joined by Jen and Jane and Jason at Public Health and Charlotte Long, who's Head of Health at Active Surrey, and my colleague Satchet, who's very kindly helping me with the tech this afternoon. Thanks, Satchet. Next slide. So for the next hour, at the moment, I'm going to speak for a couple of minutes, and then we are going to go into a 25-minute session whereby I will be delivering along with my colleagues at Public Health. We'll be covering consequences and realities of obesity, including the latest Surrey statistics, examples of a system, and also focusing on the whole systems approach to obesity framework, which Jen Smith will be delivering. At 12:30, we will be going into breakout rooms. So there should be 3 breakout rooms. Every breakout room has been assigned a facilitator, whereby you will then be invited back into the main session at 12:50 for a short 10-minute feedback session. Thank you, Satchet. Next slide. So let's make a start. So these slides you don't have to frantically write notes, so don't worry about that. So let's look at the consequences and realities of obesity. So obviously this is vast, but I think the really important thing to note here is not only the physical aspects related to obesity, but also the social and mental as well. So obesity obviously linked to depression and anxiety, type 2 diabetes, hypertension, some forms of cancer, heart disease, stroke, and liver disease. So again, being overweight or obese is linked to a wide range of diseases, and they are the most common ones, but there are lots and lots of different ones linked to obesity. Next slide, please, Satchet. So in terms of the latest data, so we're lucky in the sense that we've received the most recent active live survey data only a fortnight ago. So that tells us that approximately 500,000 adults, which is more than half of the adult population within Surrey, are classified as overweight or obese. So the exact figure is 57.8, and I'm sure you'll agree that that is significantly high. It's also really interesting to note, looking at the purple document there, the box, that in England the prevalence of obesity among adults rose and almost doubled from 15% to 29% between 1993 and 2017. And throughout this workshop, we're going to be looking at the reasons why and what we can potentially do, working in partnership to reduce those numbers. Next slide, please, Satchet. So again, we've taken the latest data from the NCMP, which is the National Child Measurement Programme. So for those who don't know, who may not have children, children get measured when they enter school, so in reception and year 6. So the stats show that 16.7% of children in reception are overweight or obese, and 26.9% of children in year 6 are overweight or obese. So again, really staggering high numbers, and we'll talk about potentially what part can we play in reducing these statistics over the next couple of years. Thank you, Satchet. Next slide, please. Over to Jane.
Right, hi, it's Jen. Sorry I was late. Couldn't get onto Zoom. Anyway, here now. So this slide is the adult excess weight as from the active live survey. And you can see, if you look down the overweight and obese column, how varied the levels are in Surrey. So we have Waverley at 50%. Then we have Spelthorne at 67.2. We tend to always find, whether it's adults or children, that Spelthorne has the highest rates of obesity. And then we think about, why is that? Well, the reason behind that is there is a social gradient related to obesity. So as deprivation increases, so does the levels of obesity. And I'd like you to think about the different sort of high streets that you see, the shops that you see in areas where it's more deprived. And I think you'll find that there's less of the large supermarkets available, more fast food outlets. So we know that all of these things that contribute to the levels of obesity. There's a lot of work that goes on across all of these boroughs, but we can't seem to actually tackle this problem and stop it from getting worse. Part of it is cultural. It's what's happening over very many years. We've gradually got fatter and fatter as a population. And I'm not just talking about Surrey now, I'm talking about probably most of the developed world. And it's become normal to be overweight, and obese is now considered just generally what we used to think of as overweight. And even health professionals cannot spot if someone is overweight just by looking at them. And that's been tested many times. So it's really important that we start to look at what contributes to excess weight, and we'll be talking about that later on. So moving on to the children's data. So next slide, please. Here we have, as Abby was saying earlier on, National Child Measurement Programme. We do this every year. It's run by school nurses, and this is really strong data because this is actually measuring our children each year. And we can see, we look back at the trends and we can see that it increases year on year. You will see that in reception it's quite bad. Children are coming into school, maybe 1 in 6, 1 in 5 children are coming to school overweight, already carrying excess weight. But by the time they leave year 6, we're looking at much higher levels of obesity. And we have to ask ourselves why. Why is that happening? Is it happening in the home? Is it happening in schools? Is it happening out and about? It's happening everywhere, I assume. We know that their schools provide good school meals. They're very controlled and monitored, the foods that are supplied. So we try to work hard with families to tackle this problem. We know that there's a window of opportunity before a child starts school, so around about weaning. So weaning, as we used to call it, or infant feeding, is to make sure that they are weaned onto healthy foods, and they don't develop that fast food sweet tooth that sometimes happens. But at the end of the day, all the programs in the world, and I've been doing this a very long time, has had very little effect on the levels of overweight and obesity in adults and children. And this is why, in Surrey, we're going to take a whole systems approach. Jane, my colleague, will be explaining that to you in a moment. But before she does, I'd like you to watch a video. So Satya, can you go to the next slide and put the video on, please? It's no sound.
Can you not hear the sound?
No.
Might have to stop sharing and share again.
Satya, we could always come back to the video at 12:50 if that's easier.
Yeah, maybe we'll just get the link and run it straight off YouTube.
No, it's just sharing the computer sound. Just bear with me.
Being above a healthy weight increases the risk of
Can you hear the sound now?
Yeah.
Okay.
In England, we have high levels of overweight and obesity across the life course. Being above a healthy weight increases the risk of many serious health conditions, which places a huge strain on our health and social care services and our wider economy. What we eat and how active we are is influenced by the environment we live, work and play in. It is this range of interconnected factors that together can cause obesity. That's why there is no simple solution to tackling obesity and promoting a healthier weight. It is everyone's business and everyone has a role to play. Elected members and senior council leaders need to support and champion a whole systems approach. This means bringing together stakeholders from across the local authority and wider community to all play their part. Developing a shared understanding of factors that drive obesity locally encourages ownership and helps prioritise actions to achieve and sustain a healthier weight and address inequalities. It is important for these actions to span the short, medium and long term. Quick wins may build support. Longer-term actions can deliver sustainable change for the better. By working together, we can better consider how actions impact others within the wider system and ensure we are joined up on tackling obesity. Taking a whole systems approach is likely to require a change in mindset and new ways of working. There are benefits for all when our environment promotes good health. These could include improved productivity and employability of local populations and a reduced demand for public services such as health and social care. Public Health England has published a guide to help local authorities get started. Search Public Health England Whole Systems Approach to Obesity Guide.
Right, hello there. Jane Semo here from Public Health.
Sorry, Jane, we're struggling to hear you, I think.
Ah, right. Can you hear me now?
That's better.
That's better. I just need to be nearer my laptop, I think. So looking at the next slide, these are the common areas of obesity activity identified as part of a whole systems approach. And just to bring that to life a bit, I've just been using a couple of stories based on fictitious characters, but on
Sorry, Jane, can I stop you there because you keep cutting out?
Okay, can you hear me now?
It's okay now, but it did cut out previously.
Wi-Fi, I'm afraid. Let me just check I've got my volume on maximum. I have. Okay, can you hear me now, Abigail?
Yes.
Okay, so let's look at the story of Claire, single mum with 2 young children. She lives on a housing estate which is out of town. It's not in the countryside, but it's out of the town centre. She has no access to public transport. She doesn't have a car, so she either walks or takes taxis. The road is too busy for cycling and there is no cycle lane, so she is dependent on walking or taxis. The supermarket is not within walking distance, so she relies on her local small shop. Unfortunately, there is not much fresh food available and it tends to be quite pricey. She has a habit of using fast food outlets for tea when she picks the children up from school, as it's nearby and it makes life easier. And then we look at a second story of Paul, who works as a nurse at the local hospital and tends to do night shifts. There's little food availability at night, so he relies on vending machines and they don't always have the healthiest options. He's new to the area, but it's an area of high crime rates, muggings, and he has no desire to exercise outdoors. He'd happily do it with other people, but is new and doesn't know anybody. So looking at those 2 stories, we can see how, when you look at the slide on the whole system, you can see how all the different parts of the system are impacting on the lives of these 2 people and really are affecting whether they're obese or not. And if we go to the next slide, please. Can you hear me still, Abigail?
Yeah, you just cut out them, but I can make it out, yeah.
Okay, so looking at the next slide, this is the whole systems approach framework that has been commissioned by Public Health England and developed by Leeds Beckett University. It's split into 6 phases, and it's about looking at all parts of the system that have an impact on obesity. And if you use this framework to work through the framework, you will find that you can identify the areas that are causing obesity, but also the areas that are helping fight obesity. And looking at the first area, phase 1, you're engaging with your senior leaders and senior stakeholders. That's very important that you get senior buy-in. Phase 2 is about building the local picture, getting local data, looking at what is available out there to help combat obesity and what is hindering that approach. Phase 3, you come together with your stakeholders, usually by way of a workshop, and you start to put together your vision. You do some more local mapping, and you put together your draft vision. Phase 4 is about refining that vision, and you end up at the end of that with an action plan. And then phase 5 is about putting that action plan in place, basically. And 6 is reflecting and as you go along and improving where improvements are needed. So this is essentially the whole systems framework that we are now promoting in Surrey. And this, we feel there's a lot of evidence to support this. Because obviously, as Jen said earlier, weight management programs are not enough, and you have to tackle all parts of the system to have an impact. Thank you.
Okay, so the next part of the session, we are going to go into breakout rooms, and we are going to spend some time, around 20 to 25 minutes, excuse me, focusing on the following 3 questions. But so the first question we're going to look at are, what are the causes of obesity within your local area? The second question, we're going to look at obesity is on the rise in both adults and children, which obviously we've spoken about previously. And by adopting the whole systems approach to obesity, what can we start to do differently that we haven't done already? So some of the things that you may have done already may not have worked. So it's about thinking outside the box and thinking about what we can do differently. And then lastly, which other partners, organisations should you be working with or could you be working with to make this happen? So again, coming away from working in silo and working with partners and organisations who have the same shared outcomes as yourselves. So Satchit is now going to pop us in breakout rooms. There should be 3 breakout rooms and a facilitator in each. So thank you, Satchit. Okay, we'll just give it a minute or so for everyone to return to the main room. Jane's group are back. Satchit, can you confirm that everyone is back now, please?
We should have everyone back now, as the breakout rooms are empty now.
Perfect, thank you so much. So thank you for your engagement over the last 20-25 minutes or so. We hope you found it helpful. What we will do is we are going to have a short, just under 10-minute feedback session now, but we will collate everyone's thoughts and ideas and send these to you following this session. So hopefully that will be helpful. So Charlotte, if we can start with your group, could you feedback on what the causes of obesity within the local area from your session, please?
Yeah. So we spent quite a lot of time on this, which meant we didn't have much for number 3, but I think it was a good discussion. So we talked about fast food outlets and actually how easy it is to order whatever you want these days on Deliveroo or whatever. That there's a disparity in active travel options according to where you live. Someone from East Surrey was talking about you've got deprivation right next to affluent areas. People don't often know what activities are available, and cost can be an issue, transport can be an issue. Not enough people to do activity with, especially those that aren't keen on activity or those that are isolated. Maybe people live in towns that's very built up, less options for moving around a green space, too many bug-off options. It's cheaper to eat bad food or unhealthy food. But we know unhealthy food can make people feel good, a big link to mental health. We talked about the massive queues at McDonald's at the end of COVID. It's easy to grab food, then make a salad when you're actually working in an office, so actually go and buy it from Tesco's or whatever. Not enough positive adverts on physical activity or healthy lifestyles. Who are our role models and our habits? We've got them from who we've grown up with. So maybe we need to tackle education. Too many bad items of food in front of you when you're at the queue, the till queue, which doesn't help when you've got children in tow. People are really busy at the moment, and they just don't have time. Then they feel they've got to work harder because employers perhaps expect too much, so we take less breaks. And just things like maybe employers should take away the vending machines. And we talked about the Costa in Royal Surrey being really busy, and people don't understand the cost of a latte and things like that. Coffee culture is a big thing these days, and it never really existed. Well, not when I was growing up anyway. So that's it.
Thanks, Charlotte, really useful. I think we'll move on to the next questions because I think there'll be a lot of discussion around the next 2. So Jen, if I can come to you, please, for by adopting the whole systems approach to obesity, any thoughts on what we can start to do differently going forward?
The first one was to stop looking at obesity as a medical issue. And I just want to say on that note that I've been to a few Parliament talks, and they're actually trying to make this obesity a disease, I think for funding purpose, but actually it's not necessarily a medical issue. If you're obese, then your body is actually working the way it's supposed to. You are storing energy for another time. So we need to stop looking at a medical issue and take a holistic approach. Making every contact count, so taking those opportunities to speak to someone, so don't be afraid to raise that issue and look at what areas might be helpful. So if someone in front of you, a bit like Jane said earlier, they've got financial problems, they're not going to be too worried about what food they're giving their children, just as long as they can give food to their children. So it might be, do we need to look at financial options? Are they on the Healthy Start vouchers? Do they get those? Are they using a food bank? Can we get the offer that food bank give out to be more healthy? Those kind of things. And then a really important one, how well do we know our service users? What do we know about their lives and what's important to them and what worries them and what makes life difficult? And I think, I'll be honest, I think that's probably the most important thing to take home from this. Know your service user, know where they are, what is happening in their life. And once you start to tackle some of those barriers, which may be, you think, not connected to their weight, but are actually influencing it, that's when you really start to make a change. So changing those opportunities for people, whatever they might be. I'm going to stop there.
Thank you, Jen. Jane, did you want to add to that?
Yes, I mean, we just basically said, came up with quite a few ideas of things that are either happening or could be happening. like community fridges, taking excess fresh food from local stores and schools and offering that for free. There are quite a few initiatives already across Mid and East Surrey, I think, around that. Linking in with partners, for instance, or planners rather, when you're perhaps going forward with a regeneration project, but trying to get in at the beginning of projects so that you can build active travel into the design of, into planning design. Encouraging places that sell food to put calories on the menus. I know that doesn't happen very much. More education and knowledge for families. We could be doing more of that, and that could be delivered by the school nurses or health visitors. You know, really, a lot of the things are probably happening at a very small scale, but they're not having a big enough impact because they're few and far between. So I think, yeah, that's what we came up with for number 2.
Brilliant, thank you, Jane. And the last question, we've just got a couple more minutes. So if I could hand over to Jen for any other partners which we should be working with to make this happen.
Yes, so first of all, service users. Co-production, like we said before, find out about that, you know, what influences and what's important to them, to get them around the table. Head teachers, so that framework that we showed you is about leadership, and head teachers lead the schools. That's really important. The local leisure provider, that can offer some opportunities for physical activity, for some learning. And then local authorities, of course, very strongly, so benefits, customer services, planning, you know, housing, those kind of services. And then to actually make sure that all the feedback from these different services, so the data, the insight that they do with the customers, actually all speak to each other and build a strong network across all of the services to really make a difference and change the environment that people live in.
Thank you, Jen, and thank you to all our facilitators for that great feedback. Much appreciated. Satchit, could you move on to the next slide, please? Perfect. So if you're interested in finding out more about the whole systems approach to obesity and specifically Surrey statistics, then we will send this presentation around to the group, and there's lots of suggested reading and resources that you can take a look at to drive your agenda going forward. Next slide, please, Satchit. So Active Surrey are running a series of activating your community lunchtime workshops over the next couple of months. So if you are interested in any other workshops related to your work programs, then obviously please feel free to take a look at that, and you can book those via Book When. So lastly for me to say is thank you for joining us this afternoon and for all your input. It's much appreciated. Like I said, I will send these slides round and I will send a summary of everyone's discussions. If anyone has met a different partner or organisation that they feel that they want to work with going forward, then obviously I can't share the emails due to GDPR, but I'm more than happy for you to send me an email, and then I will connect you both via that way, if that's okay. So please feel free to make contact with us. We will stay on for the next couple of minutes if you've got any further questions, but thank you very much for joining us, and have a good rest of your day.